Sometimes I feel that everyone wanted to be a doctor in their childhood, but somewhere their efforts failed. But that wish, that desire to be a doctor manifests itself by self-treatment or by passing immature, ill-formed advice to colleagues, friends and relatives. Self-medication is a menace nowadays. And in a country like India, where every medicine almost is available over the counter, this menace has grown, has escalated 100 times than what it used to be earlier. People are unaware of the side effects or the adverse effect of a drug that they are taking. Even aspirin, which is taken to protect the heart, can cause severe bleeding from your stomach if you are harboring a peptic ulcer. You don't know. But people go and take it. A person who's got a very poor liver function takes a tablet of Calpol all by himself and goes ahead to develop a acute fulminant liver failure. A person takes certain drugs or certain antibiotics which are toxic for the kidney, not knowing that his kidney is compromised and thereby shuts down the kidney permanently. The most dangerous aspect of self-medication today is antibiotics. Taking unsolicited antibiotics or taking solicitations or advice from non-medical or paramedical individuals, taking inadequate dose in inadequate frequencies results in resistance to organisms. Today, if I speak from the platform of hospitals, especially intensive care units and acute medical wards, we are struggling against resistance. There are such terrible organisms or simple organisms which have become terrible, or opportunist organisms which live in our body, which thrive in our body normally in a symbiotic, they just live there. They turn into severe pathogenic infections and it becomes so difficult to treat them even with the highest antibiotics. It takes so much of cost, so much of effort, and yet lives are lost. So sepsis, septicemia starts occurring because of resistant organisms. Tuberculosis has become resistant today. We have got multi-drug resistance and excessive, almost all drug resistance in certain tuberculosis. I request people to please refrain from self-medication. Please approach your doctor. Please ask a doctor to advise you. Most of the times you won't need antibiotics. Most of the time simple medications can solve diseases. We unnecessarily go in for self-medication, or we unnecessarily go in for advice and collateral advices which don't help, which actually kills. Thank you very much. Namaskar.